I'm just going to introduce some of the new changes to the cancer end of treatment summaries across Manchester that you should start to see in the primary care setting in the coming few months. First of all, what is an end of treatment summary? So, an end of treatment summary is essentially a summary of all the care that a patient has had in the secondary care setting that's related to their cancer diagnosis. Primarily, it's a document that's written for patients, but it also serves as a really useful summary for the people working in the primary care setting. It includes all the treatments that a patient has had, any relevant diagnosis, and any investigations that they've had undertaken. It also includes useful contact details for cancer specialist nurses, for example. Importantly, it includes a summary of some of the potential late effects that a patient might have, either related to their cancer itself or the cancer treatment that they've undergone. And this is going to become increasingly important for those working in the primary care setting, for clinicians seeing patients who are living much longer after their cancer diagnosis and maybe dealing with late effects of their treatment. It also includes some signs and symptoms of potential recurrence of disease. Again, really important for patients to be aware of what to look out for so they can present early, but also for us as clinicians to look at to see could this be a recurrence of their disease that's coming years on down the line when they were first from when they were first diagnosed. It also should include any actions for the GP. And this includes things like maybe a prompt to reassess for frailty, considering things like the gold standard framework, for example, and also things like whether or not they need follow-up DEXA scans, which is something that is often done in primary care. Importantly, these documents may look a little bit different for those with metastatic disease or non-curative cancer. They might not be called end of treatment summaries because these patients don't really end their treatment, but they still serve as really useful summaries for these patients and also for clinicians. These are some of the changes that we've brought about. So there's two new cover pages, and the idea behind these is to try and standardize what these end of treatment summaries look like across different settings. So many different hospitals deliver cancer care to patients, and also to make them much more recognizable, so to make them stand out from just generic clinic letters, for example. They include a new logo at the top, which again makes them all visible and easily seen. It includes useful information for the GP, which is contained within the first page. And again, these are often quite long documents, so it's quite useful to have this summary of information on the front page. And finally, importantly, it also contains really useful information on how to code these documents. This includes within DocMan, so to code them as their cancer end of treatment summary. And then secondly, within EMIS, so to actually put them as a problem heading. So using the SNOMED code cancer end of treatment summary plan. And I'll explain why this is important on the next slide, but essentially it prompts a protocol that will help you to code relevant information from this document. The second page is mainly for the patient, so it contains a very useful summary for the patient of what the document's for, why they might want to take it, for example, to hospital visits or appointments, and also some useful contact details as well. So as I've said, once you've entered the end of treatment summary code as a problem heading within the EMIS consultation, it should prompt you to run a short template. And this can be done by an administrator who's read the document. Essentially, all the information that this template asks for is included within the end of treatment summary. So, for example, it includes things like whether to tick the box of whether the patient's at increased risk of osteoporosis or increased risk of cardiovascular disease, and this may be helpful years down the line. It also includes a summary of the treatments received and any future investigations or follow-up requirements, for example, things like DEXA scans that the patient might need in the future. Once saved, it just saves it as a very short consultation with some useful bullet points that can be easily searched and easily found within EMIS consultations. Hopefully, these changes to the end of treatment summaries will make them much more recognisable, much more easy to navigate both for clinicians and for patients, and will improve the coding of this information so that we can continue to care for patients many years after their cancer diagnosis and beyond their secondary care treatments.